Hi, my name is Ashley. This is for Nursing 215. I'm doing a simulation video of discharging and education on a patient that's going home with new medications for diabetes and hypertension. This is his discharge summary, and then I have a wallet medication card that I made for him with his new meds and the current meds he was taking at home. Knock, knock. Hi, Mr. and Mrs. JD. My name is Ashley. I'm one of the nurses here today. Mr. JD, I'm glad you're feeling better and that you're able to go home. Before we get you out the door, I just want to go over the new medications you're going to be taking, since your lifestyle at home might be a little bit different now with your new diagnosis of hypertension, high blood pressure, and diabetes type 2, okay? So I know the other nurse went over the finger sticks and the blood pressure with you. Do you guys have any questions or concerns about that? No? Oh, Mrs. D, she takes her blood pressure at home, so she's a little professional too, huh? Yeah, okay, great. I'm glad you take your blood pressure at home and you feel confident with that. So let's just talk about some quick tips for the finger sticks. When you wash your hands, please make sure they're thoroughly dry before you poke yourself. You're going to want to wipe away the first blood and then use the second blood. You can pump your finger, aim towards the side. It'll hurt a lot less than in the middle, okay? All right, no concerns about that. Good. So, Mr. JD, before we start talking about your new medication, let's go over and recap your current medications that you were taking home before your hospital stay. So do you remember what they were? Synthroid and Protonics. Perfect. All right, so Synthroid, also called levothyroxine, generic and trade name, same thing though. It's for your slow thyroid, okay? That medication is important to take early in the morning on an empty stomach, okay? Even before your morning coffee, because sometimes when we drink our coffee, we forget and we start eating and then, right. Good, okay. You've been taking it for many years. Okay. And the Protonics, also called pantoprazole, is for heartburn or reflux. And you're going to want to take that about a half hour before a meal too, okay? So no questions or concerns regarding those two medications you were taking at home before? Right, you've been taking them for years. Okay. No issues obtaining the medication, getting them from your pharmacy or having insurance? Okay, great. All right, so let's talk about the new medications that you're on. The doctor put you on 2 different blood pressure medications. The first one we're going to talk about is metoprolol. It's also called Lopressor. This is a beta blocker. You're going to be taking 50 milligrams once a day, okay? So a beta blocker slows your heart rate, okay? And it relaxes your heart. This way it doesn't have to work so hard. Because your heart rate is slow, we tell everyone that's taking this medication to be careful when they're standing, because you might experience some dizziness or lightheadedness, okay? You also might feel a little bit tired. So just be careful when you're standing. If you're getting up from a laying position or even sitting, just make sure you don't feel dizzy before you stand up, okay? When you're laying in the bed, sit at the edge of the bed, dangle your feet, take a deep breath, think about your day before you stand up. Don't get up too fast. Right, yes. You don't want to get up too fast because you don't want to fall. Okay. The next medication is Zestor, which is also called lisinopril, and you are going to be taking Zestril, 10 milligrams a day, okay? So the important thing with this medication is that it also helps relax those vessels and opens them up so the blood flows a little bit more easier, okay? And it also helps protect your kidneys, which is very important now that we know you have diabetes. This medication could cause a dry, tickling cough. It's more annoying than anything else, but if it becomes persistent, please let us know. Also, it can cause a severe allergic reaction that may cause lip swelling, tongue swelling, or face swelling. If you experience any of those signs, please call 911. Again, that's an adverse allergic reaction, and it's very rare, but we do want to make you aware. The most important thing you need to know about blood pressure medication is that you want to take it even when you're feeling better, because if you stop taking the medication, your blood pressure can skyrocket up again, and we don't want that to happen. We want to protect your heart and your kidneys. Okay? So any questions about those two medications? No. Okay, good. So we'll move on to your metformin, which is your glucophage, and you're going to be taking 500 milligrams daily. And this is for your diabetes, okay? You're gonna take this orally, so no, you do not have to poke yourself except for the finger stick, okay? This medication, it's kind of hard on the stomach. It could cause some tummy upset, some nausea, vomiting, diarrhea, a metallic taste in your mouth. So we do advise you take this with your biggest meal of the day. If you have any muscle aches, weakness, shortness of breath, feeling like you can't catch your breath, please call your doctor right away, okay? And again, even when he's sick, please make sure he's taking his medications, okay? Do you guys have any questions or concerns about those new medications or why you're taking them? Okay, so since you guys don't have any medications and I explained everything, Mr. JD, can you tell me which medication you want to take on an empty stomach? Protonics and, that's right, your Synthroid. And which medication do you want to take with a full stomach? Yep, the metformin. You want to take it with the biggest meal. And Mrs. JD, since you're the one that usually sets up the medication and helps Mr. JD with his medication management, do you have any questions or concerns? Right. You're going to want to still take the medication when you're sick. So for alcohol, it's best to avoid alcohol right now, especially while we're getting his blood sugars under control. Alcohol can make his blood sugars drop too low and cause dizziness from the blood pressure medication. So that is a good question, and we're glad that you bring it up. Any other questions or concerns? No? Okay, so you can sign this. This is your discharge summary. It has all the information that you need regarding his new medications and common questions and concerns. And then this medication card that you can keep with his medications or in his wallet or with you. And it has the medication, the dose, why he's taking it, and the reaction to look out for or when to take it, okay? Well, it was nice meeting you guys. Thank you so much, and we wish the best of luck to you in the speedy recovery.